She's not just big on music.
She's big on making sure you have a good time.
Every time. Ayanda, MVP.
947 loves you.
Finally, the moment we've been waiting for, well, the moment I've been waiting for, to bring my gynecologist live onto 947 for a chat. How are you, Doc?
I'm good. Great to be here. Hey?
I'm happy that you're here. Let me introduce you to the audience. Dr. Kwaw Asante is a specialist obstetrician and gynecologist. He's the founder of Gynae Worx, a Johannesburg-based healthcare service that provides trusted obstetric and gynecological healthcare. Jeez.
Yeah.
So
Obstetrician. Yes.
That's where you are a doctor for pregnant women.
For pregnancy and all things related to pregnancy, yes.
And then gynecologist is for us normal women that
health.
don't have babies yet.
Yes,
and we're just going through the pains and we just need your help. All right, doctor, I'm still going to read more on you. It says here that you're passionate about obstetrician and gynecology and you strive for excellence and perfection in all aspects of life. The professional, clinical, as well as surgical components of your life are no exception to this. You understanding nature coupled with his open-mindedness and complete love of his profession enables him to accommodate and treat patients with satisfying results. And that's why you're actually here today.
Truth.
I really like how you break situations down for me when we're in your practice because I ask so many questions. Am I the only one who asks so many questions?
Nope. Women are very inquisitive people.
Why are we so inquisitive? Because we don't understand what's going on.
Your bodies are so complex.
Why are they so complex?
I don't know idea.
But when did you fall in love with practicing gynecology and being an obstetrician?
You know, it's actually a very strange story. So in med school, you go through all the different disciplines. So you go through general surgery.
I've seen that on like Grey's Anatomy.
Yeah, you go through, you like do a rotation for every speciality.
How many years is that?
All in all, 6 years, eh?
Yeah.
But it's spread over the course of the 6 year, the 6 year training. So funny enough, obstetrics and gynecology was one of the things that actually I found very difficult in med school. To the point where, you know, I got to the stage where I had to write the final exam for obstetrics and gynecology, meaning the final exam, meaning if you don't make this exam, you're repeating the year. So by the time you get to that point, you've studied this thing so well that you know it like the back of your hand, or you should know it by the back of your hand before you actually go ahead and write that exam, because it's literally do or die. And at that stage, you know, I studied it so well. I left no stone unturned because I'm like, I am not going to flunk this thing, you know. And I think in that process of learning it and, you know, studying it to the extent that I needed to know it, you actually fall in love with it. Because I think the more you have a love for something, the easier it is to understand, the easier it is to actually go face an examination. And I think that's what actually got me through that hurdle. And then after that, I just felt there's nothing else in medicine for me other than, you know, this obstetrics and gynecology thing.
It chose you.
It literally has to choose you, because, you know, the other things that are required, the time, you know, the dedication, pregnancy is no child's play. Literally, pregnant women, like I said, they're spontaneous, they can have questions, they can have emergencies at any time of day, and you have to be available. So in as much as it's a professional, it's a professional career for me, it does also delve into a bit of personal time as well, because you can't necessarily isolate the two completely. So yeah, it has to be a combination.
So that means you have 2 cell phones.
I've got a lot of cell phones.
Okay, so let's go back before we get to pregnancy. Let's talk about how important it is to go and see your gynecologist as a woman on a yearly basis, once or twice a year.
Look, once a year is fine, but as to how often you see them in that year is dependent on what the outcome of the first visit was.
Okay.
So obviously, if you go to a gynecologist and they pick up a problem, you may need to follow up with them closer than someone who hasn't had any problems in that first visit. But generally, once a yearly visit to a gynecologist should more than suffice.
And that's when you go for your pap smear.
So that usually that visit is a pap smear coupled with an ultrasound scan, and then the gynecologist will ask you more directed questions about your menstruation, you know, contraceptives that you're on, and you know, family planning in terms of when you want to have children. Is there a desire? Is there no immediate desire? And what your plans are, basically.
Absolutely. Now, I had a chat with a friend of mine once who said that she had a situation where she had to go for surgery for it, and that was due to something known as HPV.
Yes.
Can you take us through that and help us understand? Because people are probably thinking something else when I say HPV.
Yes. So HPV, it stands for human papillomavirus. Okay, so this is a sexually transmitted virus. Okay, it's the same virus that, if untreated, can eventually grow to cause cervical cancer in women.
Sure.
So the point of seeing a gynecologist is to do a pap smear as part of the yearly checkup, so that you can detect this HPV in its early stages before it actually grows to become a cancer. So in its early stages, HPV is very treatable. Meaning, if you pick up the abnormality, you can treat it either by giving it time in terms of observing whether your body can naturally fight it off, or by actually, like in your friend's case, going for surgery to actively treat it. And then once it's treated, then you do your yearly follow-ups to make sure that a recurrence does not occur. But the important thing to note about HPV is that it is sexually transmitted. And even
does this mean, sorry, Doc, to cut you, does this mean even if I use protection, I could still get it?
It depends on what level of protection we're talking.
Okay.
So condoms usually help fight the spread of HPV.
Yes.
They're the only type of contraceptive, if you would, that would actually help in the prevention of HPV.
Okay.
But mind you, HPV is not only contracted via vaginal intercourse. So we're talking oral intercourse, anal intercourse can also lead to the spread of HPV as well.
Oral intercourse.
Oral intercourse.
Oh
Yes.
man.
I just had to. I had to take it there. Sorry, man.
Wait. Okay. But if it's by oral intercourse, then how does it affect my cervix?
So remember, when you actually have intercourse
Yes.
or oral intercourse, once you have the HPV in your oral cavity, it becomes a systemic type of infection.
Oh.
But it has more of an affinity. An affinity means a like for the gynecological organs of a woman, particularly the cervix. Do you understand? So HPV can also, in some instances, affect the throat of women, where you actually develop genital warts, not laryngeal warts in the case of the throat, and vaginally you can develop vaginal warts in the case of HPV that affects the genitals, aside from it causing cervical cancer. So it's just a matter of where in the body does this virus have an affinity for, and usually orally and vaginally are the more common areas. The same thing with something like herpes. I mean, you've heard of people who have herpes in terms of like blisters.
I saw the pictures in school back in
LO.
LO.
And then people look at you like, where did that come from? So usually herpes would be an oral thing. So you get HSV1, herpes simplex virus 1, which attacks the mouth, and herpes simplex 2, which attacks the vagina. So that's where it has more of an affinity for. Meaning those are the areas it's more likely to.
So why isn't it affecting the male? Why must it affect the female only?
It's a tough one. But the thing is, it does affect the males, but not to the extent that it affects females. So the thing in a male is it can cause things like genital warts. It can also cause penile warts. And in the male, the idea is there aren't really directed tests like pap smears, which would help screen, for a male to actually know if they're at risk of this. For a male, they'd have more visual. Okay, there's a genital wart. Let me go get it checked out.
Okay.
And guys are more, I don't want to say, like women tend to be more inquisitive, like we said. So women will be the first to go seek help.
Because we can see everything going on down there. We're like, what's going on now?
Yes, and by the time it gets to that stage in a guy where he feels like he needs to get help,
it's too late.
It's usually it has to be really bad.
Oh my word!
Whereas for a female, you may have early changes that can cause cervical cancer, but you feel physically fine. So you don't have the warts or any, because you can't necessarily see any changes on your cervix or feel any changes on your cervix unless you do a pap smear and then it picks it up. Oh, you've got this and this type of cell, and this cell could eventually lead to cancer. So that your body doesn't prompt you as far as HPV is concerned, except when it's very late already.
But we can both, as male and female, take the vaccine.
Yes, you can. Yes, you can. The earlier on in life that you're exposed to the vaccine, the better. So that's why the vaccine is now currently being implemented in children, in school-going children, as early as 8-9 years old. Because remember, the thing about HPV is prevention is better than cure.
Yes.
And the vaccine aims to prevent. So the idea is that school-going girls, 8, 9, 10 years old, have not been sexually exposed as yet. So by giving them the vaccine before that first sexual encounter, you're actually protecting them from getting HPV in the event that they actually have that sexual encounter at a later stage in life. Yeah.
So I'm due for shot number 2.
Yeah.
And I had to wait because I took the first shot and I waited a good 3 months.
Yeah.
Why do we have to wait for so long?
So the idea is usually the first dose of most vaccines is the main dose. Then you need to get the boosters to try and help your immune system to integrate the components of the vaccine into your system.
Okay.
So you do require in the case of HPV, you require the 3 doses over roughly the course of a year to be able to actually gain the kind of immunity that you need.
Okay, so now that I'm busy with my HPV vaccine right now, I mean, I'm going to see you next week for my second shot.
Here we go,
because you're my gynae.
Yeah.
But now I also have a second shot due for the COVID vaccine.
Yeah. So
which one must I go with?
It's just vaccines all over the
I
place.
know. My poor arm.
So listen, the idea is, remember, vaccines usually they I don't want to say attack, but they integrate into your immune system.
Yes.
So the idea is you don't also overburden your immune system at any point in time. So my suggestion would be finish the dose of or the course of one type of vaccine before embarking on another. Usually would recommend a period of about 6 weeks to 3 months interval between two vaccine courses to allow the body to integrate that particular vaccine into your immune system before you embark on the next dose of another vaccine.
Okay, so I can make the decision as to which one is going to be.
You can see.
Okay,
yeah,
no, that's so good.
Yeah.
That's so good.
So if I see you, I know what time it is.
Yo, for real, dog. Now, I want to know, let's take it back a bit with contraceptives.
Yes.
So you were discussing certain contraceptives, and at some point I used to always come to you and say, Doc, oh my word. Actually, I forgot to tell people how I first met you. So there was a situation, I think it was my 28th birthday. Yeah, I got really drunk. But all the time, every single time it's my birthday, I'm always on my period. It is always that time of the month. And I was so drunk on that certain birthday. I couldn't remember if I had actually, taken out my tampon or not.
Yeah.
So in my mind, I was frightened that this thing is still up there and I might have pushed it even further up. And that's when I came to see you and I was
hectic.
like, Doc, it's here. I don't know. I think it's stuck inside. Am I going to die? Do you have to surgically remove it?
Yeah.
So, but it turns out that there was nothing there.
Yeah,
but I still felt it. I still felt as though it was in there.
Yeah.
Is that a thing?
It is a thing. Because remember, the thing about contraceptives in general, and even tampons, is it's hard to keep track of as a woman. There's a lot that you as a woman need to keep track of in your life. The last thing you want to worry about is, did I leave the tampon in there? Did I forget to take my contraceptive pill? That kind of stuff. But it does happen often because there is a lot.
Have you surgically removed tampons?
Not surgically. In the rooms, yes, we have.
Oh, but it's still a surgical procedure
of
sorts.
Yeah, it's still some. Yeah, we have to. Not really a surgical in a sense, because remember, surgical would mean that we need to take you to theatre, put you to sleep, and then do what we need to do.
Yes.
But anything that we can do in the room generally doesn't require anesthesia or any form of pain medication. So we are able to do it, like physically remove tampons that have been lost or...
they've been lost!
Well, lost is a bad word, but, where it's been forgotten.
Yeah.
And then we have to remove it and,
And has someone ever forgotten but just felt a pain?
Yeah, they've forgotten. And remember, there's always a consequence of leaving the tampon in for a prolonged period of time. The common thing that can occur is infection. It can actually progress to what we call toxic shock syndrome, where it actually affects you systemically.
Yeah.
So you leave the tampon in for a long time, and your body mounts an immune reaction against it, and that can cause the infection, the discharge, the pain, and eventually toxic shock syndrome, which is actually quite severe form of an infection in that case.
Sure.
Yeah, but we can take it. It's not common, but when it does happen, it's we have to tackle it.
Sure. Okay. Yeah. So then I started telling you after that happened that I have severe period pains and oh my word, I don't know if I can take it anymore.
Yeah.
And you were like, have you tried contraceptives?
Yes.
But my biggest fear was that I felt as though I was too old to be taking contraceptives now.
Too old?
Yeah, I felt like 28 was an old age because, at some point you start taking it maybe in varsity and you get used to the type of contraceptive.
Yes.
I felt I was too old because now I didn't feel like going through the phases of trying it out, having my acne come back because I'm trying something different. I don't want to look ugly. That was my fear. Like if I start putting contraceptives on trial, now I'm going to go through different changes and mood swings and I'm in a great relationship and I don't want to mess it up.
Life's good. Yes,
that's what I felt by saying, that's what I meant by saying I feel too old.
Yeah.
So when is it advisable to start that journey of thinking about the certain types of contraceptives?
So the thing about contraceptives is, remember, anyone who has the capability to conceive or fall pregnant but may not necessarily want to would then require contraception. So if you're in your fertile years, so your fertile years is defined as anything in your 20s up to late 30s even, you understand? So if you're in that age group and pregnancy is still a possibility, then you should ideally be on contraception, because then otherwise it prevents things like unwanted pregnancies. So that would be the first premise of being on a contraceptive. Obviously, being on a contraceptive, depending on the type, will have its drawbacks or side effects. You understand? So that is when we delve into the type of contraceptive based on your lifestyle, your preferences, and the kind of side effects you may have experienced previously. All of that will come into play. But it's important to note that the main aim of a contraception is primarily to prevent pregnancy. So if you're someone who's trying to not fall pregnant, then ideally you should be on a contraceptive. Another aspect to contraception as well is the fact that many people would believe that, once you're on a contraceptive, you're almost immune to sexually transmitted infections. That is a myth.
It's a lie.
That is a lie. So in that case, we start talking about what we call dual contraception. So dual contraception is any type of contraception that would conventionally prevent pregnancy coupled with a condom.
Oh, I see.
You understand? So the condom is the only one that would then offer you the protection against sexually transmitted infections. Granted, a condom use alone would also grant you protection against a pregnancy, but you would use that in combination, just to make sure that you're covered in terms of sexually transmitted infections and falling pregnant.
Okay.
So you're making doubly sure now.
So why did you suggest that I use contraceptives for my period pains?
So the idea with contraceptives is that they've got hormones in it that your body would naturally produce. That's estrogen and progesterone. So and majority of people who have period pains or irregular period means that there's some sort of imbalance with regard to the hormones that your body is producing. It could be influenced by stress. It could be influenced by aggressive exercising, weight loss, weight gain. A number of things can affect your hormone composition. So by giving you a contraceptive, we're trying to mimic what your body would naturally be doing. We're trying to train your body to say, listen, this is what you should actually be doing to maintain this lady's hormonal balance. So we usually give you a trial of the contraceptive for a period of time. Usually it's about a 3-month period where we train your body in that 3 months that this is the dose that you need to
And then
maintain.
why do the pimples come out and everything?
It's all the side effects, unfortunately. So because it's hormones, you will get side effects like pimples, the sex drive may be decreased, weight gain,
mood
swings, headaches. Okay, but the idea is the more you take the contraceptive and your body gets used to it, the more these actually become more bearable and to a lesser effect on you.
But that's why I said no, because I was just like, I can't be going through all of that.
Yeah. But it's all trial and error with contraceptives, really, because we never know what your body's going to take well to, unfortunately.
That is true.
Yeah.
All right, now we are done with, the woman who's going through the most once a month between, 4 to 7 days.
Yeah.
And then you get to the woman who just found out she's pregnant.
Exciting stuff, eh?
Exciting and scary stuff at the same time.
Fair enough.
And I keep telling you, I'm so scared, but I'm excited, but I'm scared, but I'm also excited. Like I saw a friend of mine recently who came from surgery and she made my knees go weak. And I think to myself, will I even be able to give birth? Will I even be able to?
Of course. I think by virtue of just being a woman, you're capable of more than you think you are capable of.
Yeah, I guess.
Yeah, true. No, you're capable of it, and childbirth is no different. And I think the thing about pregnancy is it's because you're venturing into the unknown. And it's with all things in life. When you venture into the unknown, there's nervousness, there's excitement, there's fear, all these emotions that come into play at that point in time. But luckily, you've got people who can guide you and who can tell you, listen, it's actually going to be okay. You can do this. You can actually go through this. Your body was made for this. But I think the important aspect of pregnancy is the psychology of it all. And in this day and age, we've got a lot of influences. Social media is there, the internet. There's a lot of things that will tell you what you want to know or what you want to. So you'll find whatever it is you're looking for. So the idea is to try and sift through all of this to actually find out what works for you. But no, you're definitely capable of seeing it through.
I hope so.
Yeah.
Does being pregnant mean my life would be on pause?
Not necessarily. I think being pregnant will be, it's a part of your life.
It's a part of my life.
It's another chapter of your life.
I am an athlete. You know, I play netball.
Yes.
I go to gym every day.
That shouldn't necessarily change, particularly in the early stages of your pregnancy. Obviously, as the pregnancy advances, things may become physically more...
I can't be goal shooter with
a
goal in my stomach. But
so obviously, you need to take more precautions as far as your lifestyle is concerned. The later on in the pregnancy,
I can't do gigs. I can't be a DJ in the clubs.
Yeah, up to a certain stage in your pregnancy, you may still be able to do that. But ideally, you'd want to take precaution as far as your pregnancy is concerned.
What do I have to stop immediately when I find out that I am pregnant?
I think when you find out you're pregnant, there's a lot of things that you have to actually look back on in terms of your medical history and in terms of if you've been pregnant before, what occurred in that pregnancy, and generally how the pregnancy journey was then. You understand? So if you find out you're pregnant, ideally you should actually be planning your pregnancy ahead of time. Really? Ideally, in an ideal world. Remember, because the thing is, most things are made worse in pregnancy most things are made better in pregnancy, and medical conditions are no different. So people who have high blood pressure, sugar diabetes, epilepsy, asthma, all of these conditions are bound to undergo some sort of change in pregnancy. Some are for the better, some are for the worst. So ideally, it's always good to plan your pregnancies with whoever is looking after you for these conditions to see, okay, when is the best time to fall pregnant? How much medication do I need to be on before we can consider it safe in pregnancy? Do we need to change these medications in pregnancy? You know, because most medications will need to, you'll need a lag time for it to leave your system before you actually conceive. Because once you conceive, it may have an effect on your baby. And remember, the idea is in the first 12 weeks of pregnancy, it's very delicate because that's when your baby's forming.
Oh, wow.
So if you've been taking medication that you thought, oh, you know, this should be fine, and it's not, that's the time when it can actually do the most damage.
Ooh.
So majority of us should actually be planning our pregnancies, but it's not the easiest thing.
Yeah, I mean, I see it's becoming more prevalent nowadays. Is it because people are getting married or getting together at a later stage in life?
Yes. Particularly when you talk about something like careers.
Yes.
People are looking to further their career.
Absolutely.
And have stability in terms of financial, emotional, relationship-wise. Have all these ducks in a row before they actually embark on the journey of pregnancy. There's no right or wrong to it. That's the honest truth. It's just a matter of what it is that works for you. But, you know, you need to bear in mind that the longer you wait in terms of trying to fall pregnant age-wise, the more of a struggle it may be to conceive. And even in the eventuality that you do conceive, that pregnancy may be of a higher risk compared to a pregnancy that occurred, you know, at an earlier age in your life.
It's 2021. I'm 30 years old.
Yeah.
How much time do I have left?
You got time.
I got time.
You got time. Yeah.
Really?
Yeah. Just stay away from the 40 mark, the 40-year-old
Is
mark.
it?
Yeah.
No, but Doc, I get to the agreement is I told you I want 5.
Yeah.
So how am I going to get the 5?
Oh, hectic. So we're talking like one child every 2 years then
Is it?
between now and 40, hey?
Between now, but I still have to do my HPV first.
Yeah.
So between
So
31 and 40.
There we're talking. But
Okay.
you wanna try to have it as far away from 40 as possible.
Can pregnant women take the COVID vaccine?
Yes, they can.
Okay.
Yes, they can. Because remember, the thing about the COVID vaccine, or rather COVID itself in pregnancy is an immunosuppressive state. I don't want to call it condition because it's a state. And as such, immunosuppressive condition means that your immune system is weakened or less effective than it was when you were not pregnant. So as such, you're more prone to getting severely sick if you get things like the flu or any other condition in pregnancy. So if a pregnant woman, God forbid, gets COVID, she has a higher chance of getting severely sick and needing ICU admission and ventilation and all of that kind of stuff than someone who's pregnant and has gotten the COVID vaccine. So we recommend that the COVID vaccine be taken in pregnancy, ideally after the 12-week mark. But generally, it just has a better outcome in terms of survival should a pregnant woman contract COVID-19 in the time of a pregnancy. Yeah.
I've seen like a lot of reels. There's this woman who says, if you haven't had a pandemic child.
Yeah.
Have you, is that like a true theory?
Yeah, there are many pandemic children. Because, I mean, the truth is...
How many children did you deliver this year actually, or
I've
last
lost
year?
count, It's
Really?
crazy. Yeah, because the thing is, the first real lockdown was in March.
Yes.
So 9 months later, it was crazy.
Are you serious?
It was crazy. What do you expect when you lock people down, you know?
Hey, this is true. This is very true.
I'm not complaining though.
Yeah, no. It's
I'm
good
not
business.
complaining.
It's good business.
Yeah.
So now, the birthing situation has happened. The delivery has happened. The
Yeah.
baby is comfortably at home.
Yeah.
Mom's on maternity leave,
Yeah.
3 to 6 months.
Yes.
And dad's only on paternity leave for like 2 weeks.
Yeah, it's crazy. Hey?
Why?
Remember, in as much as this may not necessarily sound right, but the moms are the primary caregivers of the children. Because whether, breastfeeding, whether it's a mother's touch, whether it's soothing, whether it's the maternal instinct of it that sets in once you've delivered your child, there's just certain aspects of parenting that fathers will never be able to mimic as well as a mother does. You understand? I don't know if they take this into account, in determining, how much paternity and how much maternity leave is allocated. But I can say that, mothers, as far as the care needed for a child, it's like none other. It can't be replicated in the form of a father, unfortunately.
But what I'm thinking in my mind is that 2 weeks paternity leave is for the father to be taking care of the mother who's taking care of the baby.
Yeah.
So if I only have my partner taking care of me for 2 weeks, what then is going to happen?
Because remember, after the 2 weeks, the idea is that you as a mother you'd be on your feet now.
That's whack.
It is whack, but you'd be surprised how quickly mothers adapt to changes of parenthood, particularly first-time mothers. Because before, when you're pregnant, you feel like, oh, I can't. How am I going to cope? It's a baby. It's, if you have a C-section, it's a wound that you need to nurse. It's, now you have self-esteem issues as well. You're going through postpartum depression, and you're like, I just can't cope. You understand? So the first 2 weeks is there usually for your spouse to also support you, and also in that time to try find support structures, whether it's a family, a relative, or anyone, because you'll find that most people after the delivery would go home or would actually go home to do the delivery at home, simply because they have the support of the mother and, other families.
Let's talk about delivery quickly there.
Yeah.
You mentioned people can deliver babies at home.
Yeah.
Are you talking about midwives?
No, at home as in like close to where they live.
Oh, I see.
No, not at home.
But do midwives exist in our country?
Yes, midwives do. Yes,
okay.
And they definitely do have a place in our country. Yes.
There was a friend of mine who gave birth in water.
Yeah, water birth. Very popular.
Very popular?
Very popular.
Painful?
The idea is it's the belief is that it actually helps relinquish the pain.
And then will my baby be able to swim? Sorry, I know it's a silly question, but I'd imagine that if you're born underwater, if anything happens and you slip and I'm like, no! And I catch you, but you manage to turn yourself around and you can swim nicely.
Unfortunately, it doesn't translate
doesn't work
to
like
that.
that.
No.
Oh,
But it would
okay.
be pretty cool though.
They would be cool. Okay, so then there's water birthing, and
Yes.
it also helps soothe the pain.
Yes. So remember, the idea with labor is there's a lot of discomfort.
Why is it so long also?
It's contractions. Remember, the idea is labor is a process in a sense that the mouth of the womb, the cervix, needs to now open and dilate through a series of rhythmic contractions, which then facilitate it to open up.
So elastic band just keeps doing this.
Yes. And that band should get to about a 10 centimeter length.
Only
That's a lot.
is it?
10 centimeters is a lot. And once you get 10 centimeters, then the idea is then the head is able to come through and then enter the vaginal cavity. And then that's where the delivery would then happen.
What if my partner has a big head?
Well, then we'd be able to pick that up ideally prior to you actually going into labor by the size of the baby's head and the weight of the baby.
Okay.
So remember, the idea is you can deliver pretty much any child normally. But the idea is there's so many risks associated with missing a child with a big head or trying to deliver a baby who is bigger than normal vaginally. The risks of, cerebral palsy, the risk of vaginal tears for you, the mother, it can be very, very, very traumatic. So the idea with antenatal visits is to pick up all of these and then at the end come up with a birth plan that suits you, based on how big the baby is, based on your preferences, based on what's happened previously in your other pregnancies as well, just so that we prevent any mishaps from happening during the labor and delivery process. And that's where C-sections come in.
Okay, so now you're in labor, the contractions are happening.
Yeah.
Has the water broken already?
It may or may not.
Okay.
So sometimes, I know on Grey's Anatomy, you see splash.
Yeah.
And you think, whoa, okay, labor's happening now, It doesn't usually happen like that in real life.
Okay.
Not usually. A majority of the time, when you're in labor, maybe when you get to about 5 or 6 centimeters of dilatation, then we'll rupture your membranes by ourselves. So we break your water, then it further facilitates quicker dilation to 10 centimeters. But it's very rare that you'll come in and then, your water breaks as a first time. But it can happen. It can, definitely.
Have you birthed babies that are still in the amniotic sac?
You can, but not with a normal delivery. Usually with a normal delivery, the membrane will rupture
on its own
before the head actually comes out.
Oh, okay.
Remember, the normal delivery, the head is usually the presenting part. It can also be breech. We don't usually want to conventionally deliver breeches normal, but it can. The head usually is the first part, and by the time the head comes, the membranes would have been long ruptured. You have a better chance of birthing a baby in the amniotic sac with a C-section, but that must be like careful, intricate dissection if that's what you want to achieve.
No, not really.
Not really.
I just want the baby out.
Right.
Yeah.
Any means necessary.
Oh, okay. But at least we're at this point in time, there's a lot of drugs to help with the pain.
Yes. So the idea is both with normal delivery and C-section. Remember, we have to try and make you, the mother, as comfortable as possible.
So why do they scream in the movies?
Because it's painful.
Okay.
It is painful because remember the medication that we give you is meant to only give you a bit of a reprieve. But what will actually help you to actually get to where you need to be in terms of delivering your baby is these contractions. And unfortunately, these contractions are not the most comfortable of things to feel. But by giving you those medication, we give you a bit of a reprieve, and then you're able to continue a bit of a reprieve, and then you're able to continue until you get to the point where it's time to actually deliver the baby.
Sure.
Yeah, so it's a process.
It really is. Did you deliver your own baby?
I don't know. Should I have?
I don't know.
You tell me.
I mean, it's a good question to ask.
It's a great question.
But also that means the support system wouldn't have been there. So you got yourself another gynae.
Well, I didn't get myself. My wife got us.
Oh, your wife got you a gynae. Yeah, no, I mean it's her decision.
It's her decision ultimately.
Okay, cool.
No. So I'm very liberal in that.
So
sense.
she doesn't see you at all for anything.
No.
And you don't have the conversation at all with her?
No, we do. When she has back pain at home, she tells me,
okay.
is it normal? Is it something to be concerned about?
Yeah.
And then my response is, but you have a gynae. You need to hit your gynae up and find out what's up here.
Yeah.
Because I'm assuming the father and the husband role.
Yes,
and
absolutely.
I don't want anything to interfere with that while I'm at home.
Correct.
So if you got a gynae, then he or she must assume the gynae role.
So how many babies do you have? Just one?
I've got two.
You've got two babies.
Two beautiful daughters.
Aww.
Yeah. The second one is now 4 months old.
Aww.
So it's pretty fresh.
Pandemic baby.
Dude, hey, I can't just talk it, I have to live it, hey?
You know what I'm saying? Sure.
Yeah,
all right. I forgot to ask one more thing.
Yeah.
Well, two more actually.
Yeah.
So when you're pregnant,
yes.
I went to a baby shower of a friend of mine.
Yeah.
And she went from a size 4 to a size 8 or size 6 to a size 8.
Yeah.
Between the two, size 5 to 8.
Yeah.
Is that water retention or am I gaining weight?
Well, it's a combination of both.
Okay.
Because remember, the idea is there's a lot of changes that your body goes through to accommodate the pregnancy. The most obvious of which is that your blood volume will almost double in terms of trying to accommodate the needs of your uterus and the growing baby. But coupled with that as well, remember there's a hormonal component to pregnancy as well. Just as we spoke about the contraceptives giving you the side effects and weight gain, headaches, those kind of things, those same hormones are what are at play when you're pregnant. So those side effects will still exist. The water retention, the headaches, the skin problems. You've heard of pregnant women glowing. It's because of the hormonal component of it that actually contributes to all of that. It's not necessarily a bad thing.
But I see that there's a prevalence with every pregnant woman having a big nose. Is that a thing?
So remember, there's a lot of changes that happen. And in the nose, changes also do happen. So there's blood vessels in the nose that actually do expand as well. Because like I said, your whole blood volume in your entire body increases. So when that blood volume expands, even in your nose, there is bound to be changes that occur in your nose. And that's why some women are even prone to nosebleeds during pregnancy as well. Because some of these vessels in the nose tend to rupture. And when they rupture, even though it's not usually serious or life-threatening, it is something that is worth noting, and looking out for when you are pregnant.
Okay.
Yeah.
Okay. Well, I mean, I get it.
Yeah.
And I can definitely wait.
Yeah.
What about surrogacy? How does that process work?
Hectic, eh? Yeah. So and as much as, we are getting pandemic babies, you do also get couples who really struggle. I actually think, those type of couples form a large portion of the patients that I see. And so what surrogacy is basically when you get a third party to now carry the pregnancy or the baby for a couple who struggle to actually conceive by themselves. And this surrogacy basically is, so now you get this third party who now carries the baby, and you've got two types basically of how it can happen. So this person can actually carry the baby with her own eggs, or it can be the eggs of the female of the surrogate couple. Okay, so you get traditional surrogacy where you come in, you have a baby with your own eggs, and then afterwards you hand over the baby to the surrogate couple. Or you get gestational surrogacy where you actually get the couple forming the baby, and then we implant the baby or the embryo into the surrogate uterus. Okay, so you need to make a distinction as to what the problem is in terms of why the couple requires surrogacy in the first place. So if it's a problem where the surrogate couple, the female of the surrogate couple is unable to, there's something wrong with her ovaries, maybe she's had her ovaries removed, or she's had radiation that has damaged the ovary, therefore she would require that the surrogate also uses her ovaries to make that baby. Do you understand? So that is what we call the traditional surrogacy. Okay, then gestational surrogacy is obviously now when the surrogate couple they don't have any issue as far as the ovaries or eggs are concerned, but now it's just a problem with the uterus more. So it's its ability to actually carry the baby once it's formed, to hold it. So then they would then, the baby would then be formed, and then an embryo would be formed, and then they would implant that into the uterus of the surrogate mother. And then obviously there's many legal and psychological, medical aspects to it as well. So all of these need to be in place just to avoid, that issue of, okay, the baby has been born now, I want to relinquish the rights, or I want to retain the baby now that I've seen the baby, I actually want the baby,
Yeah.
So, you have
even if the baby's not theirs.
Even if the baby is not theirs, they'll feel like the idea is they have rights to the baby.
Really?
And no, but that's why you need to get the legal parts in place.
Oh.
So once the legal parts are in place, it's very hard to overcome that. You understand? But the notion is my body, my baby. You understand? So you need to really get the legal parts in place before this can even be embarked on. So there's the legal aspects of it where you sign contracts and you agree, and it's not for monetary gain or anything like that. Obviously, you just cover the expenses related to the pregnancy. And then there's the medical aspect of it where you have to actually be someone who's fit. Obviously, you must be ideally under the age of 40. You must not have any medical conditions. You must not have had 2 or more C-sections. You yourself must have been able to carry a child to term and have a living child to show that it really is it has been done before with you, and then those are some of the criteria that you would have to meet to become an actual surrogate. But there's a lot. It can get complex, but there are structures in place to make sure that the protocol is followed and that it doesn't get ugly towards the end.
Because I know people follow trends. I mean, they've seen Kim Kardashian do it now.
Yep.
All of a sudden, they want to make it a
wanna
thing
do it.
themselves. I want to be a surrogate. I want a surrogacy.
Yeah. But there are some people who really are in need of surrogate mothers because they themselves physically just can't carry babies, whether it's through the loss of a uterus,
or maybe they're just too old
condition,
now.
Maybe it's age.
What's the oldest person that you've oldest in having babies?
Yeah, 44.
44.
44-year-old.
Is that old?
Well, medically, yes, in terms of the ability to actually fall pregnant.
Really?
And remember, the idea is most of the patients above 40, if they are going to fall pregnant, usually they would go the IVF route, number one, because most of them would struggle to naturally try fall pregnant. Because remember, the older you get, the less hormones your body has. And even in the event that you do fall pregnant, this pregnancy is at a higher risk of things like diabetes, miscarriages, high blood pressure, and more importantly, abnormalities in the baby, like Down syndrome. So it's very important to try and, like I said, have your babies ideally before 40. Obviously, we've got measures and tests in place that we can do once you're pregnant to find out if this baby is at risk of, for example, Down syndrome. And then we can, pick it up and then we can discuss it and work out an amicable way forward. But ideally, the earlier you have your kids, the better it is, because then you steer clear of.
But the baby's good. The baby's
good. The baby's good. That's the most important.
That's thanks to you.
Yes, thank you.
No, good advice and good nutrition information, and also just good support system. I think
support system is very important, because you'll find that many people frown upon women who are above 40 and now want to fall pregnant. Many gynaes would frown upon them, to be honest, because it's contrary to what we are taught. To say, listen, if you're 40 and you're trying to fall pregnant, what are you trying to do here? Because you're literally putting yourself at risk. But we're not here to play God. So if you come and you're pregnant and you're 42 or 40, whatever, the idea is not for me to sit there and say, why did you get pregnant? You're 40. We're told that after 40 you shouldn't. No, it's not my job. My job is to make sure that you're as safe as possible. You're as informed as possible as to what may or may not happen in the pregnancy, so that as we go through the pregnancy journey, you can make informed decisions with the information that you've got. Because ultimately, the fact that you fell pregnant at 40 should not entitle you to less of a good health care than someone who's 20-something. You understand?
Yeah.
I think it should just be equal.
Yeah,
definitely.
Okay.
Yeah.
But I'm gonna get to work.
Yeah,
I'm gonna work on it.
Yeah.
I mean, after my HPV vaccine course, when that's done, then next year's conversation is gonna be different. And I actually snapped your book a few days ago.
Oh, hectic. Okay.
And everyone was like, "Are you pregnant? Are you pregnant?" No, I am not pregnant, but I am planning to be pregnant. And this is Dr. KOFI's book, Pregnancy Related, and. This book also, I mean, for me, I've been reading it and it's got a lot of your questions answered.
Yes.
The ones that I always keep asking, or the ones that... Yeah. So I read the first 3 chapters with my friend and we were having a banter about it. No, but is it this? No, the book says, is it? Oh, okay. What was the idea behind the book? When did it come about? Was it during our pandemic and you're just like, how else am I going to get to my clients? They need to see me.
No, look, the book actually came about by the simple notion that, look, pregnant women are inquisitive. Pregnant women will have questions to ask about nearly everything. Because remember, it's a change that your body's going through and you are not sure what is normal and what is abnormal. So it actually started off as just a little note. Because obviously, you know, I see pregnant women on a daily basis. And over time you realize, wait, the questions here are repetitive. So I wanted to just literally put together a little leaflet and say, listen, when you come to my practice, this is what you need to know. These are commonly asked questions. Therefore, I'll give you a leaflet and then you'll be able to, you know, address it if and when you feel like you have a question. But then as time went by, you know, I found that there was a lot that pregnant women needed to know. And so what started off as just a leaflet eventually ended up in literally a book, because there's just so much that a pregnant woman needs to know just to put her mind at ease and to know that, listen, what you're going through is normal or what you're going through is not normal and you should seek help. And I don't think it's something that you necessarily have to go sit in a gynecologist's office and, you know, for them to tell you, oh, it's normal, by the way, and for them to charge you excessive amounts just to hear that it was normal.
Exactly.
You know, so I felt that, you know, women need a point of reference to say, if I have this issue in my pregnancy, this is the book I can refer to. You understand? And aside from that as well, you know, there's a lot of information out there.
Yeah.
And how do you decipher what's true and what's false?
Absolutely.
So this was also meant to steer people women in the direction of, you know, truthful, well-researched in terms of information and, you know, things that I've actually gone through with my patients as well, that I can actually
literally.
Yeah.
I mean, all the chapters here that I'm seeing,
Yeah.
like, you start off very nicely, a short letter to the expectant woman.
Yes.
You speak about the normal menstrual cycle, and then you
Yes.
go in.
I go into the pregnancy.
Go in, pre-existing medical conditions,
Yeah.
costs, medical aids,
Yeah.
medical insurance,
Yeah.
choosing a healthcare provider,
Yep.
molar pregnancies.
Yeah.
You have to read the book to find out what that is. Ectopic pregnancies,
Yeah.
stillbirths, twin pregnancies.
Yep.
And there's something else I don't understand here. Yeah, ectopic, pain management in labor. We spoke about.
We spoke about
I
that.
still don't know what a postpartum is. You don't have to explain
Okay.
it. You gotta get the book. Gotta get the book.
You gotta get the book.
And the role of a man in pregnancy. I love that.
That's
that
interesting.
chapter's in there as well.
Because I think a lot of men sometimes feel like, okay, she's pregnant. What do I need to do?
Yeah.
And there's a lot that a woman goes through that you might feel are directed at you.
Yes.
But meanwhile, it's just a pregnancy taking its toll on the woman. So there's a lot in there that actually tells a man basically, listen, how to take care of the woman when she's pregnant, and not to be judgmental. Essentially, all women need is just support.
That's true.
It's just support and just someone to listen.
Yeah, even once a month when we're on our periods.
Yeah.
We just need
just support, just some
really
Krispy
do.
Kreme here and there. It's all good. Yeah.
Why are we always so moody as women? Why? Why are we
It's the
so moody?
hormones. It's the
Why
hormones.
do hormones make us moody? Why can't they make us light and, and happy?
Well, at certain stages in your cycle, it'll definitely make you feel that kind of way.
Yeah,
When
but
they-
when it's time, when it's that time, when it's round about that time.
It just depends how you choose to look at it. You
That's
know?
true.
Yeah.
Well, Doc, I'm very proud of you, and I'm very happy that this book is out, and
Yeah.
I cannot wait to finish reading it because I
Yeah.
only got it like 2 days ago.
Yeah,
but I'm
yeah.
very keen
Yeah.
to show everybody
That's
the
the
book. And here it is.
There's
This
the book.
camera. So the book is over there.
Yeah.
You can zoom in if you want.
Yeah.
Pregnancy related.
So it's pregnancy related, and it's available via my social media platform. So my handle is at Gynae Worx.
Yes.
So Gynae_Worx with an X at the end. And there's a link there, and you should be able to follow that link, and then you can get your copy of Pregnancy Related.
Absolutely.
Yeah.
And also, you don't have to be pregnant to get this book.
No, definitely.
It would be
not.
great to just read up on it so
Yeah.
you also know yourself.
Yeah, it's about that preparation I'm talking
Yes,
about.
it
So
is.
ideally, you want to prepare towards a pregnancy to ensure that there's a good outcome once you are pregnant.
Okay.
So this will definitely guide you in that.
So
in that-
apparently, they say if you think about it too much,
yeah,
it won't happen.
Yeah.
Why?
It's true. Because remember, the idea is a majority of the people who I come across who are trying to fall pregnant are stressed. So there's pressure from the partner, there's pressure from the family, there's just pressure from society as to, you're 35, you're 34, why are you not pregnant? Or you've been married for 2-3 years, where are the kids? You understand? And
Ish.
that makes the couple very stressed. And so as a result of that, there's an overuse of Google, they research, they visit doctors, they take ovulation tests, they take pregnancy tests left, right, and center. They literally want to try anything to try get them pregnant. And with this, the stress levels are through the roof. And as much as I mentioned that the hormones, estrogen and progesterone, are responsible for your menstrual cycle and pregnancy when it does happen, you have other hormones as well. The stress hormone, cortisol. So when you're stressed and you're doing all these tests and all of that, your stress hormones are through the roof. And the higher your stress hormones are, the less the hormones that you have to regulate your cycle. That's what happens. So the people who conceive are usually the ones who come to me and they're like, "Doc, we don't know how it happened." Because when it happened, they were not even thinking about it. They were relaxed. They were calm. They were not stressed.
Yeah.
They were not doing ovulation tests. They were not doing pregnancy tests. They were not doing timed intercourse. They were literally just having fun.
Couldn't timed intercourse.
Timed intercourse. It gets serious, eh?
Sorry, I'm sorry for laughing.
So literally people plan the intercourse to match the
But
ovulation.
then that doesn't make it enjoyable.
But that's my whole point, because then there's a whole other element to it where there's stress and there's performance anxiety even.
Oh,
you know?
yes, yeah.
Because now you can't really enjoy the experience.
Yeah.
And that actually leads to bad outcomes in terms of you actually falling pregnant. So you need to be relaxed, be calm. Just go about it.
Okay.
And it'll happen, you know?
And read this book.
Of course, and get the book, yes.
Get the book.
But
But Dr. KOFI, thank you so much for joining. This was a great chat, and I'm very happy. I will see you next week for our catch up.
Yeah.
Because I'm ready for that journey.
Yeah.
I really am.
Yeah.
And also, I think I want to have the babies now.
Yeah.
So I can still keep fit and keep exercising. I want to look like Sierra,
Yeah.
Connie Ferguson.
Yeah.
After I've birthed
and live
5
your life,
babies.
right? Yes.
5.
5, eh?
5.
Keyword.
I'm telling him so he knows. So he knows what to expect.
Yeah,
We'll be seeing you together next year.
For sure. No, I
Thank
look
you
forward
so
to it.
much,
Hey?
Doctor.
Awesome. Thank you.
She's not just big on music.
She's big on making sure you have a good time.
Every time. Ayanda MVP.
947 loves you.